These new rankings come from the CDC looking at several metrics, including cases and hospitalizations, and what it means from their recommendation point of views. Now that most of Metro Richmond is in the high level of community with COVID-19, is that you should be bringing these masks back out and putting them back on when you are in indoor public places. As seen on the CDC's COVID-19 community level tracker, much of the Metro Richmond area is now considered to be high. This includes Richmond, Henrico, Hanover, and Chesterfield, along with Goochland, New Kent, and Colonial Heights. The agency ranks communities as low, medium, or high based on a combination of three metrics:
hospitalizations, hospital capacity, and the number of cases in the community.
And Emily Rich with the Richmond and Henrico Health District says with each level comes different recommendations on what the public should do. The biggest change for those in the high areas is the recommendation to mask up in indoor public places, regardless of vaccination status.
Especially individuals who are immunocompromised, at high risk of severe illness, or those people that might be around people that are at higher risks. We also recommend that masks are worn anytime you're on public transportation.
Meanwhile, with the Memorial Day holiday likely bringing crowds together, albeit outdoors, Rich has this advice.
Transmission seems to be lower outdoors. That said, if you're in a heavily crowded area where you can't maintain social distancing, it is always a good idea to throw on that mask, especially if that makes you feel more safe, more comfortable.
And VCU epidemiologist Dr. Gonzalo Behrman adds people who are considered high risk should consider avoiding public indoor spaces if possible. As to the news of the area turning high, he says he's not surprised.
And I think this is an important reminder to all of us that COVID-19 has not gone away. It's also a reminder to many of us that if you're not vaccinated, now is the time to get vaccinated. If you're vaccinated and not boosted and eligible for a booster, it's time to go for a booster.
Behrman says the hope is that people will follow the recommendations and help stem the current uptick, keeping hospitals from being overwhelmed like in previous waves of the virus.
We're certainly nowhere near as being overwhelmed or overrun by COVID-19 in the hospital this time, but certainly it's also something we don't want to take lightly, want to be well prepared and keep ourselves finger on the pulse of that.
Meanwhile, along with masking, officials are recommending people have a supply of at-home test kits on hand.
In Richmond, you can get free tests from some of the libraries. You can also order tests from covidtest.gov. And Rich adds that they also have ongoing weekly testing in Richmond and Henrico, and you can find that on their website for the Richmond City Health District. We also asked Richmond, Hanover, Henrico, and Chesterfield local governments if they are considering mandatory masking in government buildings because of this shift. And they all said that while they are monitoring the situation, they are not considering a mask mandate. Working for you.